I would like to share with you the power of our minds and how the placebo affects that. I would like to share what I believe are some incredible reports from medical literature regarding placebos. In the 1950s, angina pectoris, which is recurrent pain in the chest and left arm due to a decreased blood flow to the heart, was commonly treated with surgery. Rather than doing the customary surgery of tying off the mammary artery, some resourceful doctors, who were obviously not in the US, cut the patients open and then simply sewed them back up again without doing anything. The patients who received this sham surgery reported as much relief as the patients who had the full surgery. A group of diabetics was given a placebo and told it was a new type of insulin. They had no insulin-related reactions throughout the entire study. In 9 double-blind studies comparing placebos to aspirin, placebos provided 54% as effective as the actual analgesic. Now, compared to a stronger painkiller such as morphine, in 6 double-blind studies, placebos were found to be 56% as effective as morphine in relieving pain. In a study of a tranquilizer called mefenazine, researchers found that 10 to 20% of the test subjects experienced negative side effects, including nausea, rash, heart palpitations, regardless of whether they were given the actual drug or the placebo. In the book, The Psychology of Mind-Body Healing, the author stated, in other words, the effectiveness of placebo compared to standard doses of different analgesic drugs under double-blind circumstances is relatively consistent for all studies at 60%. Now, even 40 years ago, there were over 1,000 articles dealing with placebos. Let's take a look at some of the health conditions where placebos had a high rate of activity. Cough, mood swings, diabetes, anxiety, asthma, sarcoma, dermatitis, headaches, rheumatoid arthritis, radiation sickness, multiple sclerosis, and Parkinson's. A group of patients were told they were given LSD when in fact they were only given the placebo. They had all the physiological effects noted with LSD. During a study of headache, 120 out of 199 patients receiving the placebo obtained relief. In a test of the drug clothianide versus placebo for cholesterol and cardiovascular mortality, the placebo outperformed the drug. Placebo effectiveness is in proportion to what the doctor and patient think they are using. Now, 2 placebo pills seem to be better than 1, and an injection always seems to be more effective than a pill. Placebo capsules are more effective than placebo tablets. When placebos are administered, the yellow and orange are great for mood manipulators. The dark red is seen as a sedative. White works as a great painkiller and lavender as a hallucinogen. These and even more startling results can be found in the medical literature. In every medical study, the placebo group showed positive results. Now, medical specialists claim that placebo is a nuisance to medicine, but it is a guide to our greater abilities. Yes, it is all in our mind. How we use our mind is our choice. I want you to understand the importance of what I'm sharing here. Our minds are capable. There is no limit. I'm sharing this to inspire and empower you with love, in love, and through love.